Thank you. Thank you for joining us. So Louise and I worked together at Altru a few years ago, but Louise Pinkerton, pronouns she, her, is a clinical assistant professor in communication sciences and disorders at the University of Iowa. She's also an SLP in otolaryngology at the University of Iowa Hospitals and Clinic. Louise has presented in conferences at the American Speech Language Hearing Association, Voice Foundation, Pan American Vocology Association, and the National Association of Teachers of Singing, as well as state and regional events. She has a master's degree from the University of Iowa, a vocology certificate from the University of Utah, and vocal performance degrees from the University of North Dakota and Indiana University School of Music. And North Dakota sure lost out when she left because she was quite the voice professional, and she was the best we had ever, and they'll never replace her. So we sure miss you. And thank you so much for joining us today.
Yeah, well, thank you, Nicole. Thank you very much. And I do miss North Dakota. Nothing beats Woodman's. And I found out that actually you guys have better stores than we do because probably all the Canadian traffic that used to come down. But I do not miss the snow because it's still on the ground, isn't it?
It snowed today.
It snowed.
It didn't really stick, but yeah, from 7 to 10, it like sleet snowed. And so it covered it, but no, it's 40 degrees, so it didn't stay.
Oh, okay. Okay.
Still. Do you prefer questions in the moment, or do you prefer them kind of jotting them down and asking them at the end?
I'm going to try and keep my chat up. So if people want to pop questions up, or I can't see everybody's screen, but if you can see if anyone raises their hand or unmutes, I think we can pause. Makes more sense as we go.
Sure. And I can keep an eye on the chats as well.
Yeah, that would be great. And initially, I'll get started, but what I would like you guys to do is think about what questions you might have about performance voice that you could pop in the chat, or things you want to know, or things you wondered about. And don't worry about there being something that's a silly question. It's all about the experiences you've had. And if you haven't had certain experiences, you're going to have lots of questions. So feel free to throw those in the chat at any time in general. And I can try and make sure I get to some of those too. So actually, I'm going to make you use the chat anyway. We're going to start right off with a question, and we're going to broaden the term, and we're going to talk about professional voice users. So go ahead and throw in the chat some people or professions that you think are professional voice users. Who would fall into that group? Yes, we've got lots of really good ones here, and I love that you guys are thinking really broad, because when we think performance voice, we tend to get, okay, singers, actors, comedians, things like that. But you guys are definitely getting the fact that professional voice users are politicians, are radio folks, are coaches, are news anchors. Somebody said podcasters. Absolutely. And you can run into people having trouble that are podcasters. Teachers are in there. Absolutely. Teachers are probably the highest vocal demand profession as far as just length and so forth. Yes, and telemarketers, totally. Whether we like them or not, they are heavy professional voice users. Yeah, so on this slide, I listed just some others, but I think we got a lot of them. I don't know if anybody mentioned lawyers, and we judge people on their voices, so their voice matters for their cases. Nobody said SLPs. We are professional voice users. If you don't have your voice, you probably could still do therapy, but it's going to be very difficult. It's one of our major tools, and we want to make sure we take care of it. I can't remember if somebody said fitness instructors or aerobic instructors, but we got some similar groups. And then, again, our singers and actors. Yes, audiologists. Absolutely. Absolutely. Yeah. So there's a lot of people that rely on their voice for their professional use. And I'm going to focus primarily on the performance voice, but I really just want to make sure we're thinking about all of these aspects. There's a big difference between somebody that comes in and, they're 85, they have presbyphonia, they need to be able to talk to their cat and on the phone with their kids. There's a big difference between that person's needs than someone who is an elementary school teacher who comes in and is at risk of losing their job. So we definitely want to keep those things in mind. Okay, so one of the things that makes professional voice use, sorry, I'm messing with my chat here so I can see the screen. Professional voice use hard is because of the extraordinary demands we put on the voice. For teachers, it's that endurance. Can they go 8 days a week, 8 hours a day, 5 days a week after week after week, including playground and lunch and bus duty? Okay, you got to have a lot of endurance for that. What's the range required? We're going to play a quick example here of some high range singing, and it's not opera. Okay, pretty impressive there. Okay, now I'd figure out, no, you can go back and they have Mariah Carey examples there as a comparison, but it's definitely part of popular music and so forth, those really high whistle register notes. Doing that day in, day out, doing concert after concert after concert, very high demands. Intensity, how loud it needs to be. This is an example from a Broadway production.
I'm trying the best I can to explain it to you. It's not easy to admit that I've been standing in the same place for 18 years.
Well, I've been standing with you. I've been right here with you, Troy. I got a life too. I gave 18 years of my life to stand in the same spot as you. Don't you think I ever wanted other things? Don't you think I had dreams and hopes? What about my life? What about me? Don't you think it ever crossed my mind to want to know other men? That I want to lay up somewhere and forget about my responsibilities? That I wanted someone to make me laugh?
So we've got, oh, skipped a slide there. We've got high intensity to be heard in a live production. We've got high intensity because of the emotions. And also, if you listen to Viola Davis's voice there, she sounds like she's about to cry. She's got a roughness that she's brought in to intensify and bring out the idea of anger. Ideally, for a performer, that's something that's under her control rather than something that's a sign of a disorder. But that's really demanding. And on Broadway, you're going to do 8 shows a week. You do several days where you just do one show, you do a couple days of 2 shows, and then I think you get Monday off. So very intense voice, high intensity voice use, and also frequency. Performers are going to have skilled behaviors, especially if we think of our singers and actors, very ideally well trained or well developed. The energy level that's needed may be very high. You have issues of longevity. How long is someone going to be able to maintain their career? Can they meet these demands across time? And external conditions are not always great. Theaters are not great places for nice, clean air and no allergens and good humidity. So the external conditions people perform or work in are not always great for the voice. And then any additional demands on the phonatory system. So if you think of our Broadway dancers, they have to dance and sing at the same time, or you have to be able to move and perform at the same time. So how do people get started in this? This is the idea of voice habilitation. You're training or teaching a healthy instrument how to do a skill. And there's performers out there that have absolutely no training. Some people just pick things up really well by listening and through experience, and they may not have done lessons or may not have studied things. Others will work informally. YouTube's been great for that as far as people getting access to materials and ideas. Or what like jazz musicians used to do is they would get a recording of an artist or a singer and they would actually notate out exactly what that performer did with their improvising. And then they would learn it themselves. And some people certainly still do that today. But you didn't necessarily need a teacher for that. Formal instruction with voice use is going to be done with usually private voice teachers or singing teachers, and then music or acting coaches. So slightly different terms, slightly different things they do. Working or performing with a group, like being in a choir, is a great way to get some training. Sometimes there are short-term programs. People will go to a camp, or they will go to an institute and do a week or 2 weeks. Of course, there's a standard idea of a music degree or a theater degree. And one of the nice things is we're now having more and more degrees related to popular or contemporary music. My sister actually teaches in one of those programs that's built around performing commercial music. For things like opera and musical theater and just theater in general, there are summer programs or things called young artist programs or summer stock, where you go, you do a whole bunch of shows, you get a lot of experience all together, and that usually includes a training component. So the majority of the people you're going to run into out there that are doing classical and musical theater singing and acting and dance are going to have a pretty high level of training. Popular music singers, which to me is kind of everything that's not opera or musical theater, you have people that get a lot of training, but you also have people that don't. And sometimes that can affect their longevity in the field. A couple things you may run into as far as acting training is actors don't necessarily do a lot of like individual lessons. They would if they were doing singing, but there's all these methods or schools of learning how to act, learning how to move, and these are some of the most popular ones. If you've also read about Kitty Verdellini and her Lessig Marsden resonant voice therapy, Lessig was an acting teacher who has a method or a technique, and that is where some of the inspiration was for those exercises. I'm not trained in any of these acting techniques. I do have some experience with Alexander and Feldenkrais, not as a practitioner, but as I guess, participant. Alexander is all about alignment or how you're standing and how you're moving your body, which can be really helpful sometimes for our clients. So singing wise, like I said, I kind of group things probably differently than other people do because my degrees are in classical singing. So if we look at classical, sometimes you'll hear the term bel canto used. That's a particular era of music, but the classical singing style is very vibrant. It has a ringing quality, and it's loud. And then choral music kind of falls in that classical cluster. There's a term, contemporary commercial music, or CCM, that covers a lot of the other styles. You can put musical theater in there, which is Broadway musicals and West End musicals, but also things like pop and country, jazz, gospel, metal, and all the variations thereof. All those styles fall in that contemporary commercial music. So different than classical, this is the large bulk of people that are making their living in music. Not that it's easy, but there's a lot more opportunities. And then I put it under folk, but there's also traditional musics. So, you know, in the United States, there's something called shape note singing, which is an older style of singing, or not just folk songs, but if somebody does Native American singing, or if they do Tibetan double tone singing. There's also those folk traditions. I have a link here for extreme metal vocals, but I'm not going to play it because I added some others later. You certainly can listen to it if you wish. It's another example of extreme. It's just noise. So if you're going to learn how to perform, who do you go to and what do they have to know if you're going to do training? Well, different than our field, there are absolutely no requirements legally to teach voice and acting. Ethically, I think you probably should have some credentials, but ultimately anybody could say, I'm a voice teacher, I will teach you how to sing. And there's nothing legally wrong with that. Ideally, we want the teachers and coaches that our clients are working with to be knowledgeable. So certainly somebody that has performing experience or training or both, someone that's done private lessons or coachings, maybe that have degrees. They could have studied the pedagogy or how to teach singing, how to teach acting. And then there are different programs that offer certificates or certification. So somebody could be a LESAC provider, and then they're trained in that program. I also think it's really valuable for people to have cross-genre experiences. So I've done musical theater and opera and jazz, and then taken lessons in a lot of the popular music styles, because it helps me be more well-rounded. And as an SLP, actually, then I can talk to people and I can understand where they're coming from. It's also really nice if people have actual performing experience, because the experiences you have even at a college level are very different than professional experiences. The experiences you have at high school are very different from college. The experiences you have just learning something and never taking it on stage is different. So it's nice when the teacher or the instructor has some of that experience and background. So a couple things, because there are no qualifications or requirements to be a singing or performing teacher, I'm giving you a couple caveats or warning signs. So generally speaking, if someone has the secret to make you a star, or has the secret that no one else knows, that's not someone I consider trustworthy as far as singing goes. I mean, people have been singing since probably we started talking, or even before that. I would be very surprised if there's actually some secret about how the voice works or how singing works. The field works best when we're sharing information. I mean, could you imagine if there was an SLP who was like, I can solve your R articulation issues, but it's a secret and you have to work with me to get that information. It doesn't make any sense whatsoever. Another thing is when people say, I'm the only person that can do this. I am the only person that can make you a better singer. I'm the only person that can make you a star. Well, again, as we know from our field, lots of individuals can help someone move forward with different success levels, but certainly there's nobody that is the only person with the answers. Teachers cannot guarantee success. They cannot guarantee you will be a Broadway star. They can't guarantee a recording contract. That's just, and so when people are promising that, I become, again, pretty skeptical. There are also some folks that really kind of develop a following, and it's more around their personality, and they really need almost this fanatical devotion that is sometimes, to me, borders on cult-like. Again, it doesn't mean the singing or teaching they're doing isn't right, but you don't need that. You don't need that to go along with your instruction or learning how to sing. And then the last one would be if there is someone whose students consistently have voice disorders. That would be something to watch out for, or they consistently are coming in with the same problems. Now, singers and actors are more prone to voice disorders because they are professional voice users or professional voice users in training. They use the voice to extremes. They're really exploring what all is possible with their instrument. But if somebody's consistently, regularly having people with disorders, then we have to wonder if there might be something to what they're doing or the students they're attracting. Okay, so that's habilitation. That's getting people the skills to be able to perform. When we think about voice rehabilitation, things we run into with performers is any voice disorder. Performers can still get a polyp. They can still get a sulcus vocalis. They can still get presbyphonia. They can still get neurological disorders like tremor. They would have the same prevalence as the regular population. They are at higher risk for things like nodules because nodules are use-based and higher voices are more prone to them. So if someone's a soprano, they're more prone to getting nodules than a baritone is, which is a low voice. People who are performers may be at higher risk for fatigue or swelling if they're singing when they're sick, or irritation. Oftentimes, what people report is going to be really subtle. So I've had people come in for rehabilitation for performance voice, and to be perfectly honest, their voice evaluation is quote unquote normal, but there might be a little bit of a change in the laryngeal exam, or there are really subtle changes that are in the singing voice that may not come through in the speaking voice. So it's really important that you find out how this is impacting the person and what is actually at stake. The key thing for us is they had to have had the skill beforehand. I unfortunately can't help people become better singers or actors through therapy, but you can get them back to where they were. With voice rehab, we're starting to see changes. It used to be there was a huge stigma about classical singers in particular having voice disorders, but really just about anybody. And it used to be even in the 80s where if you got nodules while you were working on a music performance degree, you were told to find a different degree and leave the field. There was just this idea that you couldn't rehabilitate a voice. So therefore people hid it, right? If you make it that big a problem, people are going to hide it. And as a field, we're not quite past that yet. People like Adele, who have been very public about their problems, and Steven Tyler has done some interesting things research-wise to have his vocal cords scoped, just lets us normalize the fact that you can have a voice disorder and it does not ruin your career. It's very important to have a laryngologist that you work with. A laryngologist is going to be an ENT that knows extra special stuff. They usually do some additional residencies and experiences. So they're like our voice guys. Some ENTs are ear guys, some are nose guys, some are head and neck cancer guys. I'm using guys as the Midwest plural. So I suppose I should say, and some ENTs are voice people. And so ideally, if you've got a performer or someone who's preparing to be a performer, you want to get them to a laryngologist because they will be able to pick up the subtle things. And the way these folks get to us is sometimes they come directly to us. Like people who know me will just reach out and be like, I'm having this problem, what do I do? And I say, go see a laryngologist because I can't tell you anything until they've looked at your throat. But you might have referrals from primary care doctors, you might have referrals from the laryngologist, and I will probably mention several times, you need to get them to the laryngologist so they get scoped. That's our gold standard, and for anybody who's performing, I really don't want to work on their cords until we know what's going on, because particularly if they have a hemorrhage, the things we would do could be problematic. Okay, so if you want to provide performance voice therapy, I keep touching the chat and it messes it up. What kinds of things do you need as a speech language pathologist? Well, first of all, you have to have your Cs or be under the supervision of someone who has their Cs. So just fundamentally the supervision we need to be an SLP. What's recommended if you want to work with these higher level performers is to do more coursework. There are opportunities just to take classes with universities. There are several places that are offering vocology certificates, which are usually about 9 credits of graduate level work related to voice function, performing, taking measurements on the voice, voice habilitation, really kind of expanding your knowledge base beyond disorders. It's great to have experience, either studying singing and acting or having done it. And if you're like, well, I didn't do that in high school, so is that a problem? You can totally do it now. I mean, lots of people join choirs. There are opportunities for adults to do theater. It could be a great stress reliever as you're doing your CF, or maybe the year after you do your CF. That you can gather that experience and take lessons or do stage work anytime. There is not at this point in time any actual certification that's needed or required. There are 2 things that you could consider. The Pan American Vocology Association now has a recognition. You can become a recognized vocalogist, and for theirs you have to show certain levels of experience across 3 different areas of vocology. So it could be performing, it could be teaching, it could be speech path, it could be laryngology, it could be science. And so you have to demonstrate experience in that. If you have a master's degree, you automatically get that category. And then you also have to pass a really intense test. I don't have this yet because I haven't had time to take the test. And you get 2 tries, and I'm like, well, I'll take it once and see what I don't know, but then I have to make sure I have time to do studying to take it the second time. We also, ASHA has approved a group to look into board certification in voice and upper airway disorders, and they are at the stage of starting to develop the board. So that's something that will probably be coming in the future. Again, personally, I don't know that I would do it because I've got lots of credentials in voice already, but it's certainly something that if you are new and you really want to particularly develop that area, it can be very helpful to focus what you're doing and help guide what you're doing, and then really identify that you have that experience and background. So what are your personal responsibilities as you go forward? I think the first thing is to know your limits. SLPs can treat singing. It is part of our scope of practice because it is part of normal vocalization. We don't go around saying, well, I'm sorry, I can't treat your running because that's not walking. It's a mode of locomotion, so we treat it. You may hear there are still some people that try and say you can't, but that is incorrect. Ethically, actually, we're kind of obligated to. And then the ethical decision becomes, what are you personally qualified to do? If you have a little background and you have some people that have been in for dysphonia and they're like, I really just want to be able to sing in church without it hurting. If you have some information and some ideas and can do some vocal work with them, that might be perfectly fine. If you've done nothing with singing or performing and you feel like you're a duck out of water and you're like, you know what, actually doing the voice therapy itself is going to be a lot of work for me, then working with the singing voice is probably not something you would want to do. And certainly when you get into those people that are training to be professionals and that are professionals, you just want to be really careful that you can provide the services that meet their needs without harming them, and that you know where referral resources are. The next responsibility here is making sure that people get scoped. We've got to make sure that they don't have cancer, that they don't have a hemorrhage, that they don't have something that is better served surgically, because we don't want to waste people's time, and we don't want to keep them from making progress. And so then, generally speaking, those high-level professional voice users, if you think you're going to get some of those, or if you randomly do, you want to know where the specialty centers are. So the closest ones to you in North Dakota are in Minneapolis. We have the Lions Voice Clinic and Park Nicollet Voice Clinic. There are also several other groups in Minneapolis that do pretty high-level voice work, but those would be the 2 I would start with. And certainly, wherever you go, you can find out who has those special multidisciplinary voice clinics. Okay, so what do we do when we want to evaluate voice disorders? First thing is, we need a scope. So that needs to be part of the plan. If you're not doing it as part of your eval, you're making arrangements to have it done. I usually start with just a regular voice evaluation of their speaking voice. Perceptually, what's going on? What are some objective measures I can take related to frequency and intensity, things along those lines. And especially if they're an actor, we want to know what's their baseline everyday voice use, or I suppose anybody that changes their voice use for their profession. For the singing evaluation or performing evaluation, you want to collect an extended history. What's their training like? What's their performance load right now? What are some of the factors about where they're performing that might be a problem? Really getting a lot of information, especially in the ways that this affects them. You know, does it affect their range? Does it affect how loud or soft they can go? Does it affect how long they can sing or perform? Those are all really important issues. There is a singing voice handicap if you're familiar with the voice handicap index. This is a version designed for singers, so it asks some more specific questions related to that. And then you can collect objective and perceptual measures, some of which I have on the other side of the slide. There is something, if you ever run across the term of voice range profile or a phonetogram, it's really cool, but it takes like 45 minutes to collect. You have the person sing their softest on every and loudest on every single note that they can hit. So you can imagine with these performers, it gives you a great picture of their voice and where they're having difficulty and where maybe they can't be as loud. But it takes 45 minutes to do that one thing. So if you run into that, I probably don't recommend it from a practical standpoint. So when I do a singing voice evaluation specifically, I'm going to have the patient perform some kind of song. We're not just going to do exercises. If they have something prepared, awesome. You know, what did you do for contest, or what's in your current role? An actor, I would have do a monologue or maybe do some text from a scene that they're doing. And I'm just going to document what they do, and then vocal exercises I do to explore their voice. I like really basic exercises that are totally uninteresting, but just to show me range, to show where there are problems with their registration or their transitions, where there's problems with tuning or tone color, things like that. We'll talk later about almost all these categories here when we talk about how to listen to voices. Voice type, so essentially think what choral part do they sing, what musical style, because there's a huge difference between an operatic soprano and a musical theater soprano and a pop music soprano. What they say their performance range is, because that's their baseline, as long as they're honest. Registration is how they shift from low to high, how smoothly they can do that, or if they know where that happens. Pitch accuracy is really important, and this isn't that do they know the music, this is can they hit the middle of the note? Can they be where they need to be? And one of the things I find really interesting is across styles, there are certain things that are really consistent, and pitch accuracy, singing in tune is one of them. Having a tone color that is pleasant or appropriate for the style is another one. We like smooth melodic lines, so people that can connect their voice and do that. I look at people's posture, their breathing, their resonance, and their vibrato, all of which we'll go into in more detail. And pretty much anytime I evaluate anybody, I'm going to be adding all sorts of extra notes. I notate things sometimes in frequencies. A lot of times I put down the pitches and which octave the notes are in. Okay, so here on one side we have the singing voice handicap. So like you have the question number 10, I am unable to use my high voice. So rating at 0, not an issue, up to 4. I think that's always a problem. The one on the other side is the audio perceptual rating instrument for operatic singing voice. I've used this for a while and I find it kind of nice because you have a scale here. And it's the idea of poor to excellent. Excellent, you know, that depends where you want to define it. Are we saying excellent is like international superstar voice quality? Or is excellent just, you know, really good and satisfactory? But it is nice for classical singing if you're familiar with it because it draws your attention to a lot of the areas that we want to pay attention to. And some of these work for other styles and some of them don't. Like appropriate vibrato, we don't always want it smooth depending on the style, but are they appropriate for what they need? Ring, though, is something that's very, very specific to classical music. But breath management is something everybody needs, and strain is something we want everybody to avoid. So sometimes that can be nice to give yourself a scale or a way to rate things. Okay, so what do we do with these folks once we get them? What's treatment going to look like? I usually try and get to singing or performance voice use pretty quickly because you get better buy-in. Sometimes people will be like, well, we got to get the speaking voice in a good place first. Well, if the speaking voice isn't actually the problem, maybe we should go right to the performing voice, whether it's singing or acting, and start working those things. And you get better buy-in because then people feel like you are taking them seriously and you are understanding what their biggest issue is and their biggest concern is. It's like, if the paycheck is on the line, I probably want to get to that kind of work right away. So there is a really good reference book, The Manual of Singing Voice Rehabilitation by Lita Scares. And these are the 6 areas she points out that we work in therapy. And I think they really cover everything. We have to think medically. What is the voice disorder? What's going on here? Is it muscle tension dysphonia? Is it is it nodules? Is it recovery from a surgery? So we have to do the kinds of things that will support that and improve that. We need to address vocal hygiene. What are they doing or not doing that would help the voice function better so we can get it in that optimal space? A healthy voice is going to respond better. A lot of it is going to be that vocal coordination and conditioning. So this would be similar to if somebody takes lessons doing vocal exercises or vocalises, learning or relearning skills to get the voice back to the range, back to the abilities that they had before. Vocal pacing is, how fast you move into full songs or monologues or scene work or rehearsals or performances, letting people know how much you want them to practice and how fast we can build towards that. Because sometimes you're doing all this work while somebody's still performing. Ideally, yeah, sure, they take 6 weeks off, you do the therapy, voila, then they go back. But that's not always reasonable or practical. Or I sometimes get high school singers that they finally have gotten through the ENT and gotten to me and, oh, the musical opens in 2 weeks. Well, that's not the right time to say, well, you know what, you're just not ready to do that. We're going to learn some exercises, and in 6 weeks, after the musical's done, you'll be ready to go. So figuring out how to fit that all in. Emotional aspects are really important. This is where those counseling skills are going to come to the fore. I feel like almost all voice involves counseling, and this, with performers, is going to be a little heavier because not only is this part of this person's identity, but it's part of their professional identity. It's part of how they earn a living. It is intricately tied into who they are. And so it can be very difficult for people to change how they sound, to adjust their schedule. And sometimes people decide they don't want to. It's like, yeah, I realize you could help me with this and it could be more comfortable, but this is my signature sound for my podcast and I don't want to change it. And that's certainly a legitimate choice. People don't have to work with us. They don't have to do therapy. And then the last one is professional factors. So considering how sensitive the information is. At the Vanderbilt Voice Clinic, they have a back entrance for all the professional country singers because they don't want to be seen coming in the front entrance. They want to keep those things quiet. And while obviously we keep everything confidential, are there other things you need to think about? Is there coordination you need to do with the client's permission, but with their voice teacher, with their conductor, with their manager, things along those lines. So seeing how you balance all of it. Okay, so there are a couple areas where we can run into confusion between the client and the provider. And I just want to point these out because I was talking to one of my students actually the other day who's doing some work with a trans man on his singing. And we were talking about, okay, well, once you graduate and I'm not around, what do you feel competent to do? And how would you go about doing this? And how would you collaborate with other providers? And she was really surprised to learn some of the things we've talked about, that voice teachers don't have to know anything in particular, and that they don't have this body of knowledge like our field does and like medical fields do. And so you don't have any idea what a person knows when they walk in and say, I sing this, or I'm a theater performer, or so forth. You have to find out. And the big one to start with is terminology. Each of the genres, each of the theater styles, whether you do straight theater or musical theater, you're going to have a lot of the same words and they're going to be used differently. And so it can become confusing to try and figure out what people are telling you. And it can also be confusing for them to understand you. And a lot of the words we use to describe voices aren't actually that technical. Like rough is one of our technical terms we use with voice. Well, rough's just a word and it has meaning to anybody else. So when my client comes in saying, I have a rough voice, I can't assume that they mean the same thing that I understand it to be. I need to ask them about it. Or like we had something, again, just a recent example, working with a transgender client who kept saying, I want to be breathy, I want to be breathy, I want to be breathy. Well, we finally figured out what she wanted was light articulation, but she called it breathy. And so until the student clinician and I made that connection of we're talking at cross purposes, we weren't able to give the client what she was looking for. So it is important to confirm those things and ask people what they mean or ask them to explain it or give an example. When people give me words that like they'll say, well, my voice gets gravelly. Okay, can you show me gravelly? Can you play me a recording of gravelly? Can you tell me how it feels? So really double checking terminology. And then also just, you know, singers will come in and say, well, I'm having trouble with my passaggio and my high notes are really tight and the onset feels rough and takes too long. And it can be helpful to, again, having done a little bit of singing or a little bit of acting, to know some of that vocabulary or how people talk about their voices in those fields. Anatomy is another tricky one. People don't know much about their bodies in general, and vocal anatomy, I mean, there are doctors out there that don't know very much about laryngeal anatomy. So it's important to take some time to educate people about that. And there's a lot of imagery used in singing in particular, but sometimes also in acting, that references the body but is completely wrong. And so people will have these misconceptions about how the body works or how the voice works. And so you'll want to take the time to make sure they actually understand how the voice works. And yes, they can still use whatever that idea was, but they need to know at least a little bit about how the voice does function. With vocal technique, that is a term that's used for how you sing, or the acting method is the approach you take to develop your roles as a performer. Those are going to have very specific language, and sometimes it's even idiosyncratic down to the voice teacher. Or down to the teacher and the student. A student says this sound feels sparkly, and so, okay, great, we'll use that term. But it's not very helpful when they go to the ENT and goes, yeah, my notes just don't sparkle anymore. Not very meaningful. So again, that relates into the terminology. And also like acting methods, LSAC has something called a call that you develop. So needing to know what that call is all about, or consonant percussion, things along those lines. So you may need to ask people to define those. A lot of the teaching that's done completely ignores motor learning theory, which makes it very interesting because people still do learn how to sing and act, but we're not very efficient about it. So you may be needing to reteach people how to learn or teach efficiently how to acquire things, and may be providing prompts and feedback that they're not used to. There's also the difference between didactic knowledge and procedural knowledge. So someone may be able to tell you how they're supposed to breathe or how they've been taught to breathe. And then you go watch them breathe and you're like, that's not what you're doing at all. Those are two different areas of knowledge. And, you know, I might have the didactic knowledge of how to do ice skating, but I have no procedural knowledge of how to ice skate. So I could talk a good talk, but I can't do it. And it's that same idea that people are not going to be able to take what they do and always be able to put it into words. And again, just because they can explain it accurately doesn't mean they will do it accurately. They're very, very different ways of learning. And so again, you'll have people saying, this is what my voice teacher taught me. I breathe like this. And that's not what they do. And I don't make a big deal about it, but just keep that in mind, that what people say they do is often not what they actually do. Hygiene, oddly enough, is not always emphasized, or people have very interesting ideas about it. One of the ones I got from a voice teacher is always eat an apple before a performance because it's the same pH as your saliva. Okay, I don't know where the evidence base for that is. Or, the whole honey in the tea. And people will say, oh, I love honey in my tea when I'm feeling sick because it just coats the vocal folds and they feel all better. If the honey from your tea is getting on your vocal folds, you have bigger problems because you're probably aspirating. So that's, again, that idea if they don't know the anatomy. I'll bet that honey feels really good on your sore throat. And I will bet that warm tea feels really great going by your vocal folds down your esophagus. But again, where's the research on tea and honey? Not sure on that one either. And then it's very important that you talk to people about the professional expectations or demands. When I work with people that are in a genre that I have not performed in, I need a lot of information to know what to expect. When somebody's at a professional level, what room do they have to make errors? What room do they have to be a little off? Or does things have to be spot on all the time? They're going to be the person that knows that information. If it's a podcaster who has 3 months worth of podcasts stocked up, you have a little room. If it's somebody that's like, no, I do Instagram reels or whatever it is, or TikToks daily, and they're always fresh and new, that's a different need. That's a different way of doing things. Of course, I suppose if someone recorded 3 months worth of podcasts all at once, that might be a problem with endurance. Okay, so we're going to delve now into describing voices. I think the perceptual skills just for listening to voice disorders, listening to healthy voices, listening to performance voices are really hard to develop. It just takes time to listen and hear and start to build that body of knowledge. You've done tons of listening in your life. You just haven't necessarily hooked terms on it or thought to break it down in certain ways. So we're going to do some work with that.
Louise,
okay,
sorry
yes.
to interrupt you. Emily had a question in the chat.
Yeah, I just saw it.
Okay.
Okay, so I'm not sure if this makes sense, but I love that. Ask what you want. I'm sure performance voice users would like to be proactive in protecting their voices so they don't hurt their voice and end up with a voice disorder. Beautiful. Is that kind of proactive therapy education something they would come to us about, or would that fall more under another specialty? That's a really good question. From a medical standpoint, we can't bill for telling people how to stay healthy, which seems kind of dumb. But like if somebody goes to the ENT to get checked out, the ENT says, you look really good, but I want you to meet with the speech path once to get some information. I've definitely done that, where we do an educational session. I like to help people develop, okay, what's my emergency plan? What am I going to do when I have problems? What am I going to watch for to know that I'm having problems? Also, one of the things to keep in mind is you can certainly do outreach. I'm going to be doing some stuff in the fall and the spring with people that are in school to be educators. The thing to keep in mind is, though we have research that says if you just tell people about vocal hygiene and how to take care of their voice, they won't change anything. So you have to have them do stuff. So if you're going to do this kind of proactive education, which I think is awesome, you want to teach people vocal function exercises. You want to have them up and stretching. You want to have them sit down and go, okay, here are my habits that aren't very good for my vocal hygiene. What do I choose to change? So you really need to get them actively involved in it. But I think those things are great. I've done talks for educators. I've done talks for music majors, theater majors. I like to say that the best voice client is the one I never have to see, right? Because if they can take care of it, then their life goes on. And it, you know, I would love to see them, but I'd prefer not to. Yeah. So excellent question. So let's talk about those perceptual skills. We just have to take the time to start putting words or labels on what we hear. And that can be very difficult because sound is intangible, right? You know, color, you can line up those colors right next to each other and be like, okay, that's turquoise and that's teal and that's seafoam. But that's very hard to do with voice qualities because it's like, okay, well, that one was rough, that one was breathy, that one was twangy. Oh, shoot, I don't have it in my ear anymore. I have to go back and listen to them again. So it's challenging. It doesn't mean you can't do it, but it's challenging. So we're going to listen to an example. And what I want to start with is just, you guys can put it in the chat. And I would love for everybody to offer something. But I want you guys to come up with a word, a phrase to describe what you're hearing with this singing. Okay, it can be any of those categories I mentioned before that we will keep going through. It could be something that's based on what you know already. It could be something like, you know, his voice sounds really blue. You know, whatever. But what do you hear when you listen to this performance? Not this one.
Hi, just moved in.
Come on.
And the crows out there yodeling the blues. Oh, da, da, hey, oh, hey. Oh, da, da, oh, oh, oh. Oh, da, da, di, lo, oh, da, di, da, 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 di, da, 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 di, da, da, hey. Oh, da, da, di, lo, oh, da, da, di, lo, oh, da, da, di, lo, oh, da, da, oh, oh, oh. Oh, da, da, oh, oh, oh. Oh, da, da, oh,
I am not a big traditional country or yodeling fan, but I love this guy. He is an amazing singer. Okay, so what I would like is for everybody to put a little something they observed in the chat, and I accidentally closed mine, so I'm going to figure out how to open it up. I might have to get out of share here. There we go. Oh, awesome. Yeah. So note, all these words you guys are coming up with are just normal words, right? And a lot of what we use to describe voice and performance voice are just normal words we've kind of co-opted. So we've got octave jumpy. Yeah, he was all over the place. We've got a bunch of twang, which is kind of a defining factor of a lot of country singing. Variation, absolutely. Range, you got it. High pitch, yep, he goes way up there. Another twang, varying pitches. Large range, energetic, oh boy, you got it. Yep, those pitch changes are very interesting. A high twang, variation in range, great. Dynamic, absolutely. And then pitch changes with twang. So the things that really jumped out to people are the tone color. That's that twang. That's how we would describe the sound or the quality of the voice. Also the range. So how high and how low does he go? He went all over the place. And then we talked about pitch variation and variation in range and jumpy. We would probably call that being flexible from a singing standpoint because he can do all that yodeling. He can go really fast. He can make quick changes. A voice that's healthy does much better at that. But some voices aren't very good at it. Like my flexibility is garbage, even for classical singing. But so it's a very flexible voice. He can make those very fast changes. And did anybody here yodeling is built on the idea of your registration break or change. So really what he's doing is he's fluttering around where his registration changes. And you can hear that shift very clearly in this style. I was trying to think. Ah, chest ahead. Bingo! You got it. Okay. So you guys observed great things about this. We could also say he's mostly in tune. There's like 3 or 4 notes that went just a little bit out. But his pitch accuracy is astounding for what he's doing. He didn't have any vibrato. It's not appropriate for the style, and you can't do it this fast. Did it sound like he was straining, or did it sound like this was easy for him? Yeah, yeah. We want singing to generally sound easy. Maybe it's energetic, but it's still easy. Yeah. So lots of good things going on with Mr. Walser. Okay. So obviously, if I went out and tried to sing an opera like that, it wouldn't work because that's not an operatic sound. And so the way we describe voices also varies. We're going to try and find a medical, technical way of trying to kind of sort of agree to say things, but genres use different terms and they have different sounds. So twangy is what I call that particular sound with country, and it's a sound we're not going to find in a lot of other styles. We also find that different eras have different terms and sounds. So if we think of modern country versus classic country, which is what he was doing, modern country is much more pop inspired. So you're going to hear sounds that are a little bit twangy, have a little bit of a drawl, but are not that twangy, generally speaking. Okay, they have a more pop sound. Different professions, different terms and sounds. Musical theater and opera overlap on a lot of the terms, but they mean completely different things. Like an operatic soprano and a musical theater soprano are going to sound totally different. You may have some people that do both, but it's a different sound quality that's wanted. It's a different acting quality if it's a different type of phrasing. And so we have to be careful because, again, you got to go back to what does this particular person in front of me mean by the vocabulary they're using. And then also different schools or different teachers may use different terms and sounds. So you might talk to all the students of one teacher and they call their voice quality billowy and lush. I don't know, I'm making it up. And you have another voice teacher and they sound exactly the same, and that's a full, rich sound. But they sound the same. Just because people develop their own idiosyncratic ways of talking about things. Remember, education is open to what people have and where they get it. So we're going to have a lot of different sources. We're going to have a lot of different just development of the way people describe things. Okay, so these are the things we're going to delve into a little bit more and look at some examples and talk about them. We're going to talk about range and voice type, registration, tone color, also called timbre. Your spell check will want to make it timbre, but it is timbre, and it's French. That's why it sounds funny. Resonance, tessitura, vibrato, pitch accuracy or tuning, and breathing, and then posture. And Nicole, remind me how long the class goes?
We have them till 8, but don't feel like you have to go that
Okay.
far. But yeah, it's a 2.5 hour course.
Okay, awesome. I just want to make sure I wasn't rushing. Okay, so as far as range goes, fundamentally, we take this from classical music or choir, if you want to think about it. Basses are going to be our lowest voices down here on the bottom. Tenors are the next masculine voice up. Then there's alto, which is the low feminine voice, and soprano, that's the high female voice. For those of you that know the piano, this red one right here is C4 or middle C. And this is approximate ranges because, like, as a soprano, I'm trying to think. I have 3 more notes on the bottom, and I have, that's middle C, C. Yeah, that's pretty close to where my top is. Okay, so everybody's going to be individual or a little bit different, and you know, you have to go with sometimes what the person says because it's what matches their style, or sometimes if you're really experienced with voice, you might be really sitting there going, yeah, they told me they're an alto, but I don't think they're an alto. I definitely ran into that when I was teaching voice lessons or working with college students. They'd come in having sung alto all of high school, and you're like, no, you're a soprano that can read music. So you were put on the alto part. But that is not where your voice sits. We have limited control over the physiologic range we have because the size larynx and vocal folds you have are the size larynx and vocal folds you have. A lot of people can push their voice higher. It's kind of tricky to push your voice lower because, you know, you length it as you have it as short and bulked up as possible, and you really can't do much more than that. But maybe you can squeak out and stretch it just a little bit longer. There's definitely a move, like in popular music, we really like low women's voices and high male voices. And in musical theater, they really like high male voices. There are practically no baritones or basses anymore in musical theater, modern musical theater. So therefore, people are moving their voice up, but they don't always fit or sit naturally in it. These numbers at the top here tell you which pitch it is. So this is middle C and it's C4. And then if I go down an octave, which is 12 notes, I have C3, C2, or C5 or C6. I do that kind of notation with pitches so that people know, if they're familiar with this, exactly what I'm talking about. And there are charts and things you can use if you know a little bit about the keyboard. You can use this, or you can even just get the frequency measurement and convert it into one of those numbers. So in addition to range, voice types usually have different qualities. So we're going to listen to some opera here for tenor and baritone, and then soprano and mezzo-soprano. And what I would like you to listen for here is the difference between the two voice types. So this would be another one where go ahead and pop it in the chat when you think of something you want to say about the tenor sounds this way, the baritone sounds this way. And the tenor sings first and is shorter, and the baritone sings second and is taller.
When you get your next big idea, say sparkly ketchup.
I thought Bryn Terfel came back in, otherwise I wouldn't have gone quite as long. Okay, so what are some ways you could describe the differences between those two voices, either the tone color or how they were using their voice? What are some words you might use for that? Yeah, good. Yeah, so smooth versus rough. Yeah, certainly. Bright and strong. Yep. Opera tends to be that. Bright and rich, I think, are kind of typical ones. Those would be ones that I would probably hear voice teachers using, and I might use that in my technical documentation. I love this. This is very clever. Brassy leather and boomy bottomed. And you know, I wouldn't put that in my notes, but that's where you start. This is what I hear. This is what I call it. And then you can start associating with that with the more traditional words. But you got to find a way to label what you're hearing first. Yeah. Effortless, again, for most styles, we want to see effortless. The vibrato is very much part of the style. Yes, Sprinterful sounds very sturdy. Yeah, deeper, fuller, those are traditional terms used. Yeah, I can't remember if I said light, but yeah, that one would be okay to use for the tenor. Yeah, so full, rich, light, deep. We've got a lot of those coming through to contrast them. Yep, and tenor definitely higher, quite a bit higher, actually. Yeah, and light versus rough. I love it. You guys are just jumping in and coming up with things. And again, that's where you start. That's how you figure it out. So now we'll do soprano and mezzo soprano. Soprano is the high voice who starts, and mezzo soprano is the opera term for alto.
May I play with you, monsieur?
A lot of this history is not known.
I hope this won't be embarrassing for you.
We're getting some good comments in there. And one of the things about classical singing that you can kind of keep in mind is the definition of what a good classical voice is really narrow. So you might notice that these voices actually do sound quite a bit alike. Whereas in other styles, you can have a much wider variety of tone colors, of sounds, and people want to be really individualistic. But when you get to it, sometimes opera singers sound pretty darn the same. Yeah. Okay. Yeah, so we've got light and strong in there. Ooh, coloratura. Very nice. Coloratura is all those fast passages. And we'd use coloratura to talk for classical, but for Don Walser, we would say he's really flexible. And this is flexible too, but coloratura is specifically a classical term. Yep, fuller, lighter, emotional, yep. So that's kind of talking about her presentation or performance. Darker, lighter, yep. Powerful, yep, we can compare that. Yeah, airy, that can be a word to describe a voice. Great. Relaxing mezzo, or I wonder if we're saying the soprano is more tense or just the combination. Again, effortful's the goal. Effortful's the goal. Yeah, and I found this one interesting, shaky. So sometimes lower voices will have wider vibrato, or just individuals will have wider vibrato. And so that was kind of giving the shaky quality to her voice. Yeah, great. I love it. Okay, so let's talk about musical theater. And this is a picture from Hamilton, which will be closing on Broadway fairly soon. I can't remember when. Sometime this year. So we've got some of the same terms. We've got legit soprano, we've got tenor, we've got baritone. So those are the same words, but we have a very different expectation for soprano. And for the soprano, I'm actually going to play an example from the golden age of musical theater. So you would hear other variations based on different time periods. But think about the difference between this Julie Andrews, which is kind of the epitome of a legit soprano, and Renee Fleming, who was the one in the piece we just saw. So kind of thinking opera versus musical theater. And so I'm probably not going to spend as much time talking through all of your comments this time, but I want you to again be comparing that operatic soprano versus legit soprano.
Hi everyone, Mark Barden here at Sandy Hook Promise. On December 14th, 2012.
I could have danced all night, I could have danced all night, and still have begged for more. I could have spread my wings and done 1,000 things I'd never done before. I'll never know what made it so exciting. Why all at once my heart will fly. I know when he began to dance with me, I could have danced all night.
And you can hear many opera singers butcher that song because they sing it like it's an opera aria. And it's not supposed to, because it's musical theater. It's supposed to sound like this. So see if you can put into words some of the differences you notice between the previous example, and you can actually compare it to the mezzo-soprano or the soprano in opera, and this legit musical theater sound. And while you guys are putting those comments in, Julie Andrews, Mary Poppins and all that jazz, and the Von Trapps, had some vocal problems and had a surgery that actually ended her singing career for a long time. She had an old style procedure done, which is called vocal fold stripping. They used to think if you just take all the mucosa off, well, the nodules come off, right? And then it should be fine afterwards. What we discovered is that when you strip the vocal folds, you actually take a bunch of the multi-layered structure with you. So then you end up with vocal folds that don't vibrate well, and they certainly don't vibrate well enough for a professional. She went through a lot of procedures and surgeries and things. And I think, is it one of the Princess Diaries movies that she sings in? That might have been her debut or her return. I'm pretty sure it was. Okay. I'm not seeing comments comparing. Is this hard? Okay, there we go. Good, you were thinking. Because sometimes it is hard. It absolutely is hard. Yeah, musical theater emphasizes the words. It's lighter and flowier. Yeah, you could say it's more feminine. Definitely, she's using a breathier voice quality. Yeah. So different tone color, different way of articulating, different way of phrasing musically, all sorts of stuff. I don't know which more pitch range. The range was actually pretty close between the two of them. Yeah. So now we're going to listen to a voice type that is called belting. I'm not sure that we can equate it to alto because actually some of the best belters are actually physiologically sopranos. But it's used in traditional folk music, it's used in musical theater, it's used in gospel, some popular styles. You can hear certain people use it in jazz, and again, a lot of the contemporary commercial music genres. So just with this one, let's think about tone color. So how would you describe the color or sound of this voice?
I'm busy.
I'll be quick.
There's no business like show business, like no business I know. Everything about it is appealing, everything the traffic will allow. Nowhere could you get that happy feeling when you are stealing that extra bow. There's no people like show people, they smile when they are low. Yesterday they told you you would not go far. That night you opened and there you are. Next day on your dressing room they've hung a star. Let's go on with the
Ethel Merman, like the definitive early belter. What words would you use to describe that? Yeah, an organic resonance. It's a little more natural, if you will. Yeah, throw out some other terms. How would we describe this? Articulate, yep. And she does use vibrato. Sometimes there's this idea that they don't use vibrato in musical theater. They use vibrato, but it's not constant like it is in opera. Yep, belting is a very strong sound. It's a full sound. Yeah, and part of why it developed is because it's easy to understand over a brass band orchestra, which they were using in early musical theater. Yeah. Yep, strained. I wouldn't say it is strained in a technical definition, but it is very effortful. It sounds effortful. Hers is healthy. She sang that way her entire career into her older age. Yeah. But it gets the words out. It projects. It can be very emotional, very exciting. Yeah, that's what belting is for. And she was a really strong belter in her era because that's older, not as old as the Julie Andrews one is. And we have belters now that go much higher. And again, it's really exciting. Yeah. Okay, so now let's listen to a musical theater tenor. So same term, different sound.
All my life my head's been filled with questions. Who exactly am I meant to be? How does one begin to rule a country? How to shoulder all this destiny? What's the thing that makes a life worth living? Why, in fact, is everybody here? What is right and wrong? Then you came along, and suddenly the mysteries are clear. Right before my eyes, there's a smile to be a king for. Right before my eyes, there's a girl I long to know. There's a heart I long to conquer. There's a hand I long to hold. There's a feeling I might spend my lifetime loving, growing old. I have come here all my life.
Okay, so throw some words out that we use to describe this. This is a much more modern sound. I actually don't know which musical this is from. It reminds me of Disney a lot. Okay, so that style of singing we would see in the Disney movies as well. Okay. Yeah, we got Disney. Somebody agrees with me. Kind of sloppy. Yeah, it doesn't have that rhythmic accuracy we see in the other pieces. Yep, conversational, moving. Do we feel like this sounds like it's a high voice? Yeah, it definitely doesn't have that deep, rich quality to it. Yeah. You'll notice I put baritone in parentheses for musical theater because the poor baritone basically can do chorus in modern musical theater, can learn how to sing tenor, or can do stuff that was written before 1990. Okay? Musical theater has really kind of eliminated this voice part. It's oftentimes associated with bad guys and villains, things along that part. Now those people are high voiced too. So genres down here, information there. We also within musical theater have different time periods. So the first example we listened to was legit or golden age. So 50s, 60s. The belting is kind of a traditional Broadway sound, kind of overlaps that time period. Contemporaries, the one we just heard. And then I want to listen to a pop rock example because that starts to become popular in the 70s, where we really bring a heavy rock and pop influence into the pieces. And so the singing's got to change. And this is a studio recording.
Oh, hey! I was just going for a drive, which is wild because up until very recently, the thought of driving more than 5 minutes away would send...
I am what you want me to be, and I'm your worst fear, you'll find it in me. Come closer, come closer. I am more than memory, I am what might be, I am mystery, you know me, so show me. When I appear, it's not so clear if I'm a simple spirit or I'm flesh and blood. But I'm alive, I am so alive, and I feed on the fear that's behind your eyes. And I need you to need me, it's no surprise. I'm alive, so alive, I'm alive.
So you can hear, just look at the instruments that we've got. This is definitely a rock band that's supporting what he's doing. His singing style has to change to match it and to fit over that. And musically, if we compare it to the contemporary musical theater, it's not nearly as conversational, right? We get much more singing lines. So any observations about that singing or that voice? Yep, not a lot of vibrato. Yep, the smoothness, the connecting things. Yep. Yeah, breathiness is used very expressively in musical theater. Upbeat, the music is definitely very fast. Yeah. Yeah, but definitely more of that pop sound. There's a link here if you want to check out some more information. There's all sorts of stuff on listening for musical theater that you can find. So let's talk a little bit about registration and tessitura. So registration is about when we shift from using thyroarytenoid dominant production or modal voice or our low voice or our chest voice, and we switch to our cricothyroid dominant production where the vocal folds are more stretched out and we have the higher sound or a head voice presence. So where we make that shift, how smoothly we make that shift is something that's very important to singers. For talking, most people never notice this. But a register, using some of those terms I just used, is a section of the voice that has a similar quality. So if I stay in my low voice, my speaking range, my chest voice, it's all going to sound pretty similar to this. When I go to my head voice or my operatic style voice, that's all going to sound pretty similar up there. And then we have the middle section where we transition. So we have some picture over here. The red would be the equivalent of, to say, my chest voice. This yellow is the middle. Note the yellow is pretty big for feminine voices. And then high voice. And then this would be that whistle register from our first example, which goes super duper high. And I love in this picture because they just said first register, second register, third register, fourth register, because there are so many different terms depending on style. So if we do it classically, we're going to have one sound. We also, with musical theater, you can change the way you go through the registration, change the way you adjust the tension on the vocal folds, and that's how we get the belt quality. We bring more of that thyroarytenoid sound up. We don't blast, we don't yell with it, but it gets a different voice quality. There's also something called belt mix that can go a little bit higher, and that's more of a poppy sound. And then legit, it's in the same range as the high voice would be for classical, but it's got a different quality. Oh, mode 1 and mode 1. That should be mode 1 and mode 2. That's used by some researchers. Mode 1 being chest, thyroarytenoid dominant. Mode 2 being head voice, loft, falsetto, or cricothyroid dominant. Whatever you call it, again, figure out what the person you're working with calls it and go with that. And then a break is an abrupt shift between the registers. Yodeling is deliberately emphasizing that break. Most styles want this to be pretty smooth, or you want to choose the color you're using for artistic or musical purposes. So maybe I sometimes do this in my middle voice, but sometimes do it in my chest voice. But I don't generally want to break. And then tessitura is really important because voices of the same range are not the same. there are mezzo-sopranos that could have a pretty similar range to me, because at this point I don't have a huge top as a soprano. But I prefer my voice sits much better on the top of the musical staff here. So when I get to about D up to high C, this is where my voice can sit, and I could probably hang out there most of the day. This is what I get for moving things on my screen. Mezzo-sopranos would much rather hang out on the staff. So that's where their voice is the strongest, and that's where it's going to ring and speak and do its best, and they're going to be really comfortable there. So that's where you get into trouble when people aren't matched with the voice type that matches their voice. I can sing all the mezzo-soprano and alto music I want, but I'm not going to be very, very strong, and it's going to tire me out because it's just not where my voice sits. So we've been talking a lot in our different listening examples about tone color and timbre. So that's the character or quality of a sound. So we've used light and deep and rich and full, and twangy is kind of also a resonance term. Bright, dark. All of those describe the quality of the sound. And I will usually make a few comments when I'm evaluating somebody kind of about the basic tone color, and then if there are any distortions or difficulties with it. It can sometimes be associated with pitch, like I have a certain quality of my low voice and quality of my high voice, but it doesn't have to be. It can be separate things. And if you think about it, this is fundamentally what means you can tell different instruments apart. The acoustic signal that a guitar sends out is different than the acoustic signal that a violin sends out, and I can use that to identify which instrument it is. I can use that to identify who's singing or what kind of style they're singing. It's how you know who's on the phone right when you pick it up, because you recognize the timbre or quality of the voice. We use a lot of sensory words. We use color words. We use texture words. We use things related to resonance. Again, dark, rich, deep. We borrow words from elsewhere because there aren't musical terms that can kind of capture this. So this is an area that's very subjective, and this is where you start with what you hear. Label it what you hear, what makes sense to you. Keep listening, keep learning what some of the standard terms are. This is a really nice link here to the Kennedy Center, and they have a breakdown of voice categories in detail, and they also have some singing examples. So like the opera ones that we talked about. And what I like here is they have some adjectives. So shimmering, shining, gleaming, bell-like. Oh, apparently yellow. I've never used yellow to describe a voice. I throw it out there as something silly. So different ways you could describe it. And also you can get examples. So you can go listen to some of these singers. And you know, like Whitney Houston's there and Joni Mitchell's there along with some of these famous opera singers. So they're pulling in people from different genres. Mezzo-sopranos, dark, musky, glowing, fiery. So I think it's a really nice article if you want to delve into some more of those terms and start thinking about it. We have a question. Is there a way you can change or teach timbre? Yes, I have a gender affirmation client, and this is something she's interested about but I wasn't sure how to go about it. Yeah, what we do is we target whatever process would produce that timbre we want. If we want a lighter sound, then we need to get the vocal folds not vibrating against their full depth, but kind of on the edge. So we want to thin the part of the vocal folds that are vibrating. And we can lighten the quality, the timbre, by using more of a head voice production versus a chest voice production. So it's all kind of tied in there. So if we change the registration a little bit, we can get that lighter quality. And I'm assuming that's what she's looking for. Also, articulation changes the acoustic signal. That can help lighten up how things are perceived. So you can absolutely teach it. One of the things we want to be careful of, and I'll use a gender affirming example, is there's a lot of videos out there where people are like, okay, you need to raise your larynx, think you're swallowing, and then try and talk Try and talk with your voice in the swallowing position to raise your larynx and change your vocal tract and change your timbre. Well, what just happens when I did that is, yes, I changed my timbre because I shortened my vocal tract by moving my larynx up. But do you know how much tension it takes to hold my larynx up? You know, swallowing is swallowing. We do those exercises to make those muscles stronger. I don't want those muscles stronger. So we don't want to directly be like anatomically or physiologically, here's what you do. You want to do it by targeting the voice quality. So target making a lighter sound. Do an activity that leads to producing that sound and have the client pay attention to it and target, okay, I want to talk in my head voice. Okay, so I'm talking in my head voice and I'm listening to my sound. I'm not going, oh, well, I'm using more of my cricothyroid muscle than my thyroarytenoid. We can't do that. So that's just the thing there. Target the sound quality. Don't give specific like manual commands. But yeah, because if you think about it, that's how people learn to sing a certain style. You learn to sing country by learning to produce the country timbre. Or it's part of it. Okay, so let's talk about resonance. Very much tied into timbre, and this is how the vocal tract shapes the sound. So just like we were looking at, if I shorten my larynx, I change, or shorten my vocal tract, I change the sound. If I think about having my larynx really low, I get a bigger space and I change the sound and I change the resonance. And this is all about how the harmonics line up with the formants of the vocal tract. It's related to tone color, related to registration. If you want a certain twangy tone color, you're actually compressing the epilaryngeal, the epilaryngeal space right above the larynx where the epiglottis is. You're playing with that area and what the size of the vocal tract is there. That's how we get the classical ring. That's how we get the country twang. It's not nasality. Belting is about tuning, I think, the second formant, whereas those other styles are looking at the first formant. It just really depends on what you're looking for. So I'm going to play a couple examples. Ring is something that is a defining feature of classical music, and we're going to watch it with the spectrum, which is cool. Note how few lines you see. Very, very focused on the fundamental, and then a ring or the singer's formant at about 1,000 hertz. Okay, so we're going to come back to this video, but I have it queued up to a different spot. We're going to watch belt and listen to the sound and then look at how different the acoustic signal is. And it's all about tuning of the So here, you know, we even at a soft moment have a whole bunch, but let's get another one. She's got all sorts of upper overtones as part of this sound.
If I go, there's just no telling how far I'll go. I know everybody on this island seems so happy on this island.
So very different, again, spectral pattern for the voice qualities, and that's all about that formant tuning. And then twang. I don't have a spectrograph for this. This is just fun.
Yeah, she likes how sweet, like my sweet tea. And she likes my boots with these blue jeans. And she likes popping buttons on my pearl snap. And she likes my cowboy hat, but she loves me for my twang. Reminds her of a little hang. When she hears me on the radio, she knows that it's me by the way I sing. She loves me for my twang.
Okay, isn't he adorable? Okay, so really interesting. you may have heard how we moved into his upper range. You heard it get lighter and change a bit. Really strong twang through all of that, which of course is the point of the song. Very briefly about kids. You can totally do voice therapy with kids. You can totally do voice therapy with kids that are performers. In fact, sometimes they really need it. You have to work with them differently, but a lot of the same ideas are in play. Their system's a little bit different. His is probably pretty close, aside from it hasn't gone through puberty, but it's similar to ours. Younger kids, you know, their vocal tract and that configuration is a bit different. If you're looking to do just general voice therapy, Adventures in Voice is a full program to do voice disorders work. And with performers, you have to be really careful because, you know, who is pushing things? Is it the kid wanting to perform? Is it the parent wanting to perform? What's that relationship? Many of the kids that do performing, really their ego and their self-esteem gets really wrapped up in it. Some kid performers have a very hard time, especially as adult performers, actually, because they're used to just their self-worth comes from their voice. So you have to be really careful with it and spend some time working with them, figuring out what you can do, and, you know, keeping in mind if you do work with a kid that's a professional, that they are a professional. So you have to treat them like that. Okay, another client. Oh, you could not see the spectrum. Did anybody see it? Because I need to share my screen. So you guys haven't been seeing any of the pictures, have you? Well, we need to redo that. Let me stop sharing and I'll share something else. Thank you for letting me know. I'll just share my screen. Okay. Can you guys see it now? Okay, so just a couple lines. I'm going to stop her before the cadence. Sorry, music people. And let's compare that to the belting. So lots more harmonics.
If I go, there's just no telling how far I'll go. I know everybody on this island seems so happy on this island.
We couldn't go without doing Disney because they have been such an influential force on, well, Broadway these days, but also movie musicals and things like that. Okay, so like I said before, totally different acoustic signal. And you just have to start the twang one because you need to see how little he is. I mean, he's like maybe 12? I don't know. Someone
she
who...
likes sweet, like sweet tea. And she likes my boots with these blue jeans. And she likes popping buttons on my pearl snap. And she likes my cowboy hat, but she loves me.
Isn't he adorable? Yeah. And one of the things you might have noticed is he doesn't open his mouth very much. If you think back to the opera examples, big open mouth. Some of the musical theater ones, big open mouth. But the contemporary musical theater, more conversational. Country, you're going to see some people that they do everything like this. The jaw's practically locked and it's a very small mouth opening. Merle, was it Haggerty or Merle Haggard? That's how he sang. His jaw was practically set. Very, very small opening. And it's all about the acoustics because that produces the sound they're looking for. Okay. Vibrato. In some ways, vibrato is actually easy. It's hard to work with, but it's easy to identify. It is a fluctuation of about 4.5 to 7 hertz. You go faster than that, it's wrong. You go slower than that, it's wrong. But then some styles are a little pickier. This is something that should naturally happen if someone is singing in a relaxed way. If there's absolutely no vibrato, it's tension is what eliminates it. Okay? And if you, wrong way. Okay, so if you look over here at the diagram, we've got the healthy vibrato. It's a nice even sine wave. Then we have tremolo, which is a little bit faster, and it kind of sounds like somebody's bleating, like a goat. And then there's a wobble, which you could think the old lady in the church choir who thinks she's an opera singer. And it is so slow, but it's really slow, and you can practice. You could probably count it, whereas a normal vibrato goes too fast for that. Okay. The use is based on style. Opera generally likes a nice even one throughout the whole range. Musical theater and pop often use straight tone for a vibrato, or they accept more variation. Jazz uses a wider, slower vibrato, and there's always people that are different, but those are some of the tendencies. So we're going to listen to two examples where somebody goes from straight tone, no vibrato, to vibrato. It's called terminal vibrato, very commonly used in a lot of styles. So no movement. Yeah, and I actually like how the second woman gestures, because it's like she's keeping it straight, and then she releases and relaxes, and the vibrato comes in. And for this, you know, you usually don't target it directly. It's more targeted in the process of getting other things lined up, and then the vibrato tends to line up. Or then you work with it stylistically. And that tends to be aligned, because when we're doing rehabilitation, we're not teaching people how to sing the style, right? We're helping them match the style in a healthy way. So I don't think I'd ever teach somebody how to do terminal vibrato. That's a voice teacher's job. I wouldn't do it as an SLP. But I can certainly help them get things back to where they're able to do that, or they can do it in the music we're working on. Okay, pitch accuracy and tuning. Universal. Nobody likes to hear people singing out of tune. This is about the correct note at the right time, so accuracy there. We're getting to where we need, when we need to be there, and that we're sitting smack dab in the center of the pitch. If you're on the low side of the pitch, that's called flat. So if you ever see in the music what looks like a lowercase b, that's a note to be flat on purpose to make it a different note. This is flat where you're in between. You didn't actually go to the next note down. You're just not on the note you're supposed to be. Sharp is when someone is too high. So that's also known as the hashtag, to take a full note. But again, if you're sitting in between those notes, if you didn't get right on it, then it's out of tune. Somebody can be out of tune even if they're a cappella. A cappella means they're singing on their own, but you can hear that from moving from this note to this note, they didn't get it. Or it could be that you're listening to somebody with the piano and you're like, yeah, the piano's playing that note, and that's not what you're singing. It didn't quite jive. So we're going to listen to an example of flat singing and a little bit about auto-tune here.
I'm on it.
Hi, just moved in.
Come on. Key, a Sheryl Crow song that I sing in the car like a rock star. I would have given you all of my heart. Yikes. Well, auto-tune will save me, right? And he's taken just all that I have. Did you hear all those notes he had to correct? But if you want, I'll try to love again.
That metallic quality is where it's been altered by auto-tune.
I really was flat.
You were flat, yeah. If it does that, it means we raise it. If it's just doing a little bit, it means we're really right in tune. There's always a little bit of stuff because that's a human factor, but we can also do this.
I would have given you all of my heart.
And suddenly you're just as good as Britney Spears.
I'm thinking that's not a compliment.
Oh, burn. Okay. So one of the things to think about is there are a lot of people that complain about auto-tune, but you can very clearly tell that that was auto-tuned. And it made her in tune, but it didn't make her a better singer. Auto-tune is also used for effect by a lot of artists these days. Cher started that with one of her songs, and so it can be added as a color even if somebody is still singing in tune. Okay. And then with this, I want to talk a little bit about the difference between pitch and frequency. The pitch is what we perceive. So is our perception of hearing a sound produced at a certain frequency, and the frequency is how many vibrations per second or how many hertz it is. So I produce a sound from here that's a certain frequency. When I hear it, I recognize it as a certain pitch. Music names those. We have A, B, C, D, E, F, G, and then some flats and sharps. So when I'm reporting things, like if I've done like a conversational average, I will write down the hertz or the frequency because that's what the person produced. But hertz are not an even scale. They're logarithmic like the decibel scale is. So if we move it into pitches, then it actually makes more sense. So 440 hertz is A4, 1000 hertz is C6, and that can tell me where in people's range it is. And an interesting also is if I have 220 hertz, that's actually A3. So anytime the hertz double, we've gone up an octave. And I don't know a lot of these off the top of my head. I use a conversion chart. So if I measured 440 hertz for somebody, I would come here and I would go, look, 440, that's A4. Okay. And if I want to do a range, like let's say somebody, this would be a guy, went from 98 to 370. Okay. I could say the range was G2 to F sharp 4, and then I can actually count. It says 1, 2, 3, 4. I can count all the different notes that he did, and that gives me the semitone range. And then I can compare that to norms. Like an average person who's not trained would have a semitone range of about, or a normal voice would have 21 semitones. And I have the link here for the full interview on auto-tune. It's charming. But when I notate stuff, I'm going to do hertz and pitches. Okay, breathing and posture. We don't have a ton of research on this. This is hopefully something people are going to be delving into more. We also don't do a lot of training on it. And while we can do articulation therapy without doing our own training on how to make sounds, I think it's difficult to work with breathing and posture unless you go do some work on your own with it. Just observing what people are doing, knowing how to direct people, working with the body. And it can be really important because sometimes you just need to adjust a person's neck and it's going to take a lot of tension out and they're going to make a better sound. We had a session last week actually where one of my students was working with a client who happened to be a chiropractor, and they were working on loud voice. And they both leaned in to have this conversation as if they were at a bar talking with background noise. And the chiropractor kept his neck nice and long and was making this good loud sound. My student did this and all of a sudden had a pressed tight sound along with trying to make it loud. So I actually worked with the student on that one for her modeling. But when we could get her to get her neck lined up and lean in with the whole body, her sound radically improved. And it was actually really cool for the student because the chiropractor knew the technique we were doing and stuff like that. So it's like, yes, it is a legit thing. But if we breathe poorly, we're going to produce a poor sound, or we're not going to maximize our sound, and performers need to maximize it. If we're not lined up really well, we aren't going to be able to breathe very well. Okay. So the things we want with breathing is we want it to be easy. It should not be effortful. You don't have to bring air in. And we want it to be flexible to meet the needs. Sometimes you'll see classical singers get in this habit of taking a big, huge breath, and they go, and then they sing 2 notes. No, your breath needs to match what you're going to do. If you're going to sing a really long line of music, or you have a big bit of text that you need to present in your Shakespearean monologue, sure, take a big breath. If you're saying, yes, sir, a small breath will do that just fine. So keep it easy, keep it flexible. And when I think about breathing, I like to think of breathing all the way around. So put your hands on your belly and maybe even slouch a little bit so your feet aren't supporting you. And just take a breath. And notice if anything moves. Ideally, we want to feel our belly or right around our belly button expanding a little bit, and we don't want to feel too much in our chest, and we definitely don't want our shoulders doing anything, okay? So the next one, put your hands on the side of your ribs and take a breath and see if your ribs move. So your hands are a little bit higher than in this picture. You should feel some sideways movement, like the ribs lift up and out just a little bit, like you learned in anatomy. Next, put your hands on your upper back, so where there's still, I usually put mine flat on my back, so you can still be in the area where your ribs are, and take a breath and feel if there's movement there. It's probably not as much as some of the other areas because your spine's holding the ribs in place, but ideally you feel some expansion. And then put your hands down on your lower back, so probably just above your waistband, unless you're wearing really high-waisted pants, and take a breath and see if it moves there. Probably feel very little movement, but you can feel some. And until high waist came back, that was an easy one. Put your hands above your waistband. But thank goodness high-waisted pants have come back. It's about time. So we feel expansion all the way around our body. We feel the belly expand. We feel the ribs come forward and open to the sides. We feel a little bit of that expansion in the back. So when we go to breathe, breathe in and just feel all that movement. Okay? It should be a low, easy breath, and the air just pretty much drops in. And you can get a lot of air with very little effort, and then you can get the subglottal pressure you need for the demands that you have. That can be hard to teach to people because our brains get involved. Everybody breathes beautifully till, I can't remember if it's 2 or 3, but at 2 or 3 we start watching the people around us and imitating them. And then all of us learn bad habits for breathing. So someone can be breathing perfectly functionally to live, but it's not working for them for speaking, or not working for them for performing. Obviously, if they're still alive, it's working for oxygen exchange. An interesting thing you may run into sometimes if people's abs may be too tight, because in the United States we really have that idea of, okay, I need to have a tight core, I need to have tight abs, I need to have a flat stomach, where they can't relax that. If you can't relax your lower abdominal muscles, when your lungs go down, your viscera, your guts have nowhere to go. So you're going to be stuck with a shallower breath. So that can be something that helps people, is to learn how to relax those muscles. And also there are some people that are paradoxical breathers. So I don't know if you learn about paradoxical vocal fold motion, but paradoxical means that the vocal folds close when they're supposed to be open for breathing. Paradoxical breathing is, instead of the belly expanding out when we breathe in, people actually tighten and bring it in. So I can hardly demonstrate it. But the issue there is it's really hard to change because somebody's got an ingrained pattern that's not efficient per se, but you know, they're alive, so it's working. If they can talk fine, and if we can get things to work for whatever their voice disorder might be, I'm probably not going to retrain somebody that has that breath pattern. Now, if they're a performer, I think it would be really hard for them to get what they need with that breath pattern, so I probably would work with them on it in that case. Okay. And then with upright alignment, what we are looking for is not tense, so I don't use the word posture because then it's, oh, I need to sit straight, I need to adjust. We want to feel like there's a line from our ankles, behind our knee, through our hips, through our shoulders, through our ears, and we're standing nice and tall. And, you know, you can do activities, you can do stretches. I like to have people move and do a stretch or activity that brings them into good alignment. Otherwise, again, our brain gets involved, it becomes didactic rather than procedural, and we tend to muck it up. Our shoulders can be another area of issue because if people have them rolled forward, note my whole head just went with it. If they're pulled back too much, we get really tight. So a great one for this, and you guys can do it with me, is the big T. So put your arms straight up, put them out to your side, and then just drop them down. Your shoulders should be pretty lined up with your ears, and it shouldn't feel like you've placed them somewhere. So that's usually a good spot. So we'll sometimes teach that to people in the beginning, and I use it with lots of people that are slouchy. And just anytime in the session, you can cue, do your big T, and then they can do that and get lined back up. Okay, so if you want to know more about performance and professional voice, what do you do? Well, you do continuing education, which you will have to do for the rest of your career, which is a good thing. These are some of the stuff I would recommend. The University of Utah, and I don't think it's a National Center for Voice and Speech anymore. I think they've just changed that over, and it's a Center for Vocology. They have a Summer Vocology Institute. You can actually go out there to Salt Lake City in the summer, earn 9 graduate credits, and earn the Vocology certificate. It doesn't get you the PAVA recognition, but you're going to know just about everything you need to know to get the PAVA recognition. There are also other training programs that may be as short as 1 or 2 days or week or longer if you're wanting to be certified as a trainer. Jenny Lovetri is known for Somatic Voice Works. She's a leader in contemporary commercial music. She actually coined the phrase. Shenandoah University has a great commercial music program as part of their music department, and they do a summer program every year. Lisa Pupil has something called VoiceWorks, and she has a video and a book out, and I actually like her book on vocal styles because she gives you postures and how to shape the mouth and how you want the resonators to be. And ideally, we want people to explore and figure it out, but sometimes you just need to stop. You just need to know as the clinician what you're doing and what you want them to do, and sometimes you do just need to give them the cue of, if you're doing country, don't open your mouth, but knowing that it's a closed mouth. The National Association of Teachers of Singing does a variety of workshops through the year, and it has a conference and things like that. Also, there may be local chapters that do things. There's the American Society for Alexander Technique that does one of those movement techniques. You can be trained as a trainer. You can work with someone, and actually it's great for working on all sorts of health issues. Meisner, same thing. You can get trained in that acting technique. And then, of course, ASHA approved courses in voice. There are some in the Learning Center. There will be some offered at the ASHA conference. There's some offered all over the place. Joining a choir or doing a theater show, great way to just get some experience and explore your own voice. It's going to help you model better. It's going to help you have a better physiological understanding, build your own procedural learning, and get some of the vocabulary. Taking lessons or classes is going to be a little bit more structured. The thing I would say there is, if you do want to take lessons, make sure you have time to practice, because it's going to be very frustrating for you if you don't practice, and it's very frustrating for the teacher also. It's a little like our voice clients. If they don't practice, they don't make progress. And so to get the most out of it, you'd want to make sure you have time. But that can be a really, really good way of getting some more experience. And then what organizations support voice? ASHA, SIG-3 is voice and upper airway disorders. I think that we have a really nice discussion group. They have some interesting articles for perspectives. They had one that's about billing and creating goals for singing, because sometimes insurance is like, oh, that's a hobby. No, it's a part of human expression. So just ways to phrase things and ways to make it work for you. The Voice Foundation was started by an otolaryngologist, and they have one of the major voice conferences each summer. I think it's June this year in Philadelphia. And they also publish the Journal of Voice, so a resource for research from otolaryngology to speech and singing as well. The Pan American Vocology Association has an annual symposium. It's going to be in Miami this coming year in October, I think. It's going to be nice. We do not have a journal for that one yet, but they do have the PAVA recognized vocologists, and there's information about that on their website. And then the National Association of Singing was originally classical singers, but they're branching out and doing more with musical theater and starting to realize that there are popular musical styles out there, and actually that's what the majority of people sing. And then VASTA, I can't see it because I have all your beautiful pictures, the Voice and Speech Trainers Association. So that's actors, that's broadcasters, that's voice actors, voiceover people. And they, again, have a publication, they have conferences, lots of interesting things that they're looking into. And so you can look at these journals, read these articles, check out their websites, go to a conference, all sorts of good things. So that is what I have. Are there other questions or things you want to know? Oh, do I ever use a spectrogram or spectrograph in clinical practice? No, because I'm lazy. We certainly could, but I find in a practical sense it doesn't give me enough information to warrant taking it and finding a way to get it into the patient's chart. Now, you certainly could use it for biofeedback. That might be an interesting thing. If somebody's really wanting to work that ring, you could show it and they could follow it. Or with musical theater, you could look and, are we getting the formants we want? I don't do a lot of that because I don't want people tied to data on a device. And I want them to build an internal standard for what we're doing. I want them to feel how it feels and know how it sounds. So that's a personal choice. There are some people that really like to do it that way, and that's certainly an option. Yeah. What else? Yeah.
Do you use a VisiPitch or Pratt or anything like the high tech for your voice evals then?
You can. We have them and I train people on it, but the truth is most people are not going to end up in a voice clinic that has all that. So I like to make sure, again, people knows what's there for the VisiPitch and the computerized speech lab. I find Pratt fiddly, and I don't like the amount of effort it takes to get things out when I'm trying to do stuff quickly. So we use an iPad for a lot of our stuff to get frequencies. Voice Tools is really good there. I don't worry about jitter and shimmer because those really aren't important measures anymore. I have just started, and we haven't used it in the clinic yet, but I got a subscription to Voice Evaluate, and it's an app that can take a sample and it can do a cepstral spectral analysis, and it can actually collect your indexes, and it can collect your S to Z ratios, which actually we're stopping doing all that much anyway, but it can get you all your frequency data and jitter and shimmer if you want it as well. So that might be an option. And then Phonanium has an add-on to Pratt that will do the cepstral spectral really well. And I know some people really like it rather than trying to run all their own scripts.
Sure. Yeah. And that's what we kind of talked about in a class, because as you know, the voice lab is no longer working.
Yeah.
And we decided not to replace it. And so we use iPad apps and that kind of stuff too. But again, unless you're in a voice clinic, you really aren't ever going to do it, right?
Probably not. Or, I mean, research.
Right, exactly.
Yeah. Yeah. Okay. And I mean, I think it's good to know what the numbers mean because you might get a report back from a voice clinic.
Sure.
But yeah, we got to be able to do voice therapy where we are. And a hospital or a school is much more likely to buy you an iPad or buy you an app for your iPad than they are to buy $6,000 equipment, because we just got a new VisiPitch and it was almost $7,000.
Wow.
Yeah.
Wow. What other questions do you guys have for Louise while we have her? Anything? Now's the time.
And you can still use chat if you don't want to talk. That's okay.
Lauren, you're muted if you're talking.
For voice clients, can you do group therapy? Like, would you ever work like with multiple people or a choir or anything?
Yeah, I've done some kind of outreach things with choirs where I do the teaching vocal health and we do vocal function exercises. For voice therapy, we've done gender affirming groups, but then we do have some time where we do split up individually. So they'll learn a topic, we'll do some exercises together, do some practice, but then they get a little one-on-one time with people. I know some folks that have done group for voice disorders. I think it would be tricky. I think it'd be really tricky. But doesn't mean it can't be done. Yeah. Someone asked about emailing me. You can absolutely email me if you didn't catch my email. It's louise-pinkerton@uiowa.edu, and it's on the Iowa website. So, or Nicole has it.
I have it too, so
Yeah.
you can just reach out and I can get it to you as well.
Yeah. Yeah.
Any other questions while we have her?
Yeah.
Well, I appreciate it so much. It's so
Can I cover one more thing?
Yeah.
I'm going to advocate here. Okay. How many of you are planning on going into the schools? Oh, it's small. Okay. Often it's large. Can voice disorders be treated in the schools? Yes. Voice is a fundamental skill you need to participate in academic activities. And if they can't do music, which is a curricular activity, it's a problem. If they can't do a presentation in class, it's a problem. If it interferes with their social stuff, it's a problem. Now, keep in mind there are lots of hurdles, but you may